On behalf of the National Collaborating Center for Indigenous Health, I welcome each of you to today's webinar, Visioning the Future Public Health Series, Environmental and Mental Health. For those of you who haven't been part of this series today, Visioning the Future is a series of webinars presenting a vision for First Nations, Inuit, and Métis Peoples public health. These webinars are a development of the NCCIH's 2021 publication, Visioning the Future, a collaborative report offering a vision for Indigenous peoples' health and well-being. Privileging Indigenous knowledges, the Commission's report complements the Chief Public Health Officer's 2021 Public Health Vision Report entitled A Vision to Transform Canada's Public Health System. Today is the series' fourth and final webinar. My name is Dr. Julie Sutherland, and I am a research associate with the National Collaborating Center for Indigenous Health. Our center is located at the University of Northern British Columbia in Prince George, the traditional territory of the Kleklidene First Nation. I am, however, zooming in from Moncton, New Brunswick, on the traditional unceded territory of the Mi'kmaq peoples, and I will be facilitating today's webinar. Next slide, please, Donna. Very briefly, the NCCIH is one of 6 national collaborating centers for public health that was established in 2005 with funding from the Public Health Agency of Canada. Our sister NCCs are focused on specific topic areas, including infectious diseases, environmental health, healthy public policy, determinants of health, and methods and tools for knowledge translation. Our center supports health equity for First Nations, Inuit, and Métis peoples by promoting the use of Indigenous informed evidence to transform practice, policy, and program decision-making across all sectors of public health. Just a little bit of housekeeping for this Zoom webinar. All questions for panelists, as well as technical questions, can be submitted in the Q&A window, and you can be throwing those questions into that window throughout. We'll either answer them as they pop up or at the end during the Q&A session. Links to resources mentioned will be posted in the chat window, and today's session is being recorded and will be available on the NCCIH website. Also, just a quick note that there may be brief pauses as we switch between presenters, so please bear with us. The series has had a number of learning objectives, and you'll see them on the screen there in front of you now. They are to examine current inequities in mental and physical health among First Nations, Inuit, and Métis populations, to consider the social, political, and historical
Oh, I think Julie's video has temporarily frozen. So I will just finish the learning objectives in the hopes that she's able to rejoin us. Examine current inequities in mental and physical health among First Nations and Métis populations. Consider the social, political, and historical contexts that have been fundamental drivers of these inequities. Understand how reestablishing Indigenous peoples' health systems and ways of knowing and being are vital to overturning these inequities, and exploring practical strategies for achieving health equity. Just bear with me, I don't have notes in front of me. So today's webinar takes a, oh no, where are the? Okay, so today's webinar takes a holistic approach to considering Indigenous health, such an approach looks into and beyond the physical environmental factors affecting Indigenous people's health to include the emotional, spiritual, and intellectual landscapes that influence their overall well-being. We have 2 speakers for today's session, Dr. Shannon Waters and Dr. Chris Mushquash. Each presenter will speak for approximately 15 minutes, and we will hold a Q&A session at the very end after both speakers have presented. Our first speaker today is Dr. Shannon Waters. Dr. Waters is Coast Salish and a member of the Chemainus First Nation on Vancouver Island. Shannon works as the Director of Health Surveillance at the First Nations and Inuit Health Branch, and at the First Nations Health Authority as an Acting Senior Medical Officer for Vancouver Island Region. She has worked with Vancouver Island Health Authority as a medical director and with the Ministry of Health as the Aboriginal Physician Advisor. She is currently honored to have come full circle and will be working in her home territory as a local medical health officer with Island Health. And I think with that, Shannon, I'm going to hand it over to you.
Hi, Neta. Good morning. Hopefully people can hear me. So yeah, thank you for that introduction, Julie and Donna. It was really a pleasure to be here sharing with you guys here this morning about a topic that's very near and dear to my heart and my work, and that is on healing relationships in a time of crises. I am joining you guys here today from my home territory. I live in an ancient village site of Hulkmeetnam people known as Huatlapnates, or also known as Maple Bay. And in this diagram here, that is the location indicated by the red star. So it is along the Salish Sea. And this picture here is a depiction of my home territory. And the relationships, it shows the relationships we've had with different areas of this place we call home over generations upon generations. And many of these places are where we harvested, or where we had cultural uses, or where we practiced sayath, some of our traditional teachings. And so it is within this construct, within this relationship that has been with this land for generations, that I'm able to do my work. In sharing about myself and showing you a picture of the land, the territory, the place that I am and that I belong, that's part of my own perspective on health and wellness. And so this is a depiction that was arrived upon when I worked at the First Nations Health Authority, of how we were building the organization that we were working within and how we viewed our work on health and wellness. And in this particular slide, I wanted to bring your attention to the ringing green, which are the people that surround us and the places from which we come. And this includes our families, our nations, our communities. Donna mentioned I'm Stamanis, so I'm Hulkmeetnam from Stamanis First Nation, and I have a lot of family ties to Cowichan tribes as well. And then I also showed the land. The land is where I come from, and it's my identity. It's not just the earth, it's the ocean, the air, the foods, medicines, and all of nature. And as Hulkmeetnam people, we have done in modern times a very careful look at what it means, what our relationship with the land means to who we are. We are not of the land, we are the land. And our lawmaking authority will empower us to be the architects of a sustainable future for these lands, which we call home. I'm going to reflect back on the perspective on health and wellness again and look at the yellow ring. And this is the overarching values that support and uphold our wellness. Here we have wisdom, respect, responsibility, and relationships. And more every day now, in being a wife and being a daughter and being a mother, and in the day-to-day work that I do, I really reflect on, how do I uphold my own health and wellness in a way that respects the people around me, what responsibilities I have, the relationships, and where can I draw wisdom from. And I think it is an exciting time here in the province in BC and across the country in looking at how do we bring wisdom, respect, responsibility, and relationships to the core of our work, because of work over years and years and years to finally have a place and a space for those relationships to be protected and valued. Part of this stems from the United Nations Declaration on the Rights of Indigenous Peoples, first come forward in 2007 and not recognized by Canada until 2016. And in particular, I'll mention Article 25 here, which denotes our rights to maintain and strengthen our distinctive spiritual relationships with our traditionally owned or otherwise occupied and used lands, territories, waters, and coastal seas, and other resources, and to uphold these responsibilities to future generations in this regard. And in BC, in 2019, we have had the Declarations on the Rights of Indigenous Peoples Act come into place, which basically necessitates that all legislation within the province of BC come into alignment with the Declaration on the Rights of Indigenous Peoples, protecting our rights and thus protecting our spiritual relationships with the places we call home. Now, there's a lot of growing work around the world recognizing that this sovereignty, this ability to have that relationship with our lands is sustainable, just like the Hul'qumi'num Treaty Group had found through our work with our local communities. This report here, put out by the United Nations Biodiversity and Ecosystem Services Committee, shows over a number of years with over 500 authors looking at countless studies around the world that nature is generally declining less rapidly in Indigenous peoples' lands than in other lands, and that governance, including customary institutions and management systems and co-management regimes that involve Indigenous peoples and local communities, can be an effective way to safeguard nature. And I think what this is about is when we have Indigenous co-governance, so Indigenous nations working with communities, governments, and diverse sectors in decision-making, what it does is it centers, it puts right in the center relationships with watersheds, with lands, and environment at the center of our decision-making. And so we found around the world that there's more and more recognition of what these relationships mean for the health of the land and for the health of us all. And there's growing literature and work showing, you know, where this has the benefit for tremendous, has a possibility for tremendous benefit. Here it says that finally the world's top scientists are recognizing that we have always known that strengthening our rights is a critical solution to the climate crisis. And so what does that mean in the place that I call home, in the Hul'qumi'num territory that my family has had relationships for generations upon generations? One of the most great impacts at this point is around water. We are in a rainforest here on the east coast of Vancouver Island, and we have had very, very big variations with water over the last number of years, exacerbated by the changes in our climate. Here is two depictions of the Cowichan River, the river that sustains our people, has brought salmon to us in relationship for many generations. And you can see two big differences over the course of a year where we had tremendous flooding on the left, and then on the right, one of the arms of the Cowichan River completely dry during the summer season. We have had devastating drought over a number of years now. This picture here shows drought over the province of BC in 2021. And the last West Vancouver Island and East Vancouver Island are close to the bottom there. And you can see that there was many, many weeks that were in the red or the brown zone. Red and brown being the two highest levels of drought, and brown being where the impacts to social and environmental systems are almost certain. So we had many, many days within that category, and this was largely precipitated the beginning of this with the extreme heat event that we had in BC in the beginning of the summer. Now, I mentioned we had had drought over a number of years leading up to the highest level of drought we've seen last year in 2021. And about 12 to 15 years ago, there was a season where we had really bad drought. The river flow was really low, and people were bringing salmon by truck to bring them up the river because there was no flow for them to swim against. And that devastating impact brought people together around a table to look at what decisions can we make at a local level to help protect the river, to help to protect the fish, to help protect everything else that was affected by it. And there was a suggestion of what a model could be like for people coming around the table. And at the top, you can see the Cowichan Valley Regional District listed as chair, and then multiple stakeholders who were all sitting around the table. In red, I've circled Cowichan tribes, the peoples who have looked after these territories for generations upon generations, listed as one of the stakeholders around the table. But I got to recognize the tenacity and strength and wisdom of many of our chiefs from our community over time. And one of the chiefs who's been in that time frame, it was Chief Lydia Huitzum, and she really worked at the time to change the governance model from one where the Cowichan Valley Regional District was sitting as the lead to one where it was co-chaired by Cowichan tribes, bringing our unextinguished rights and title, along with the Cowichan Valley Regional District with their authority delegated by the province and the Local Government Act. And what this has done is really change the way all the work happens and really put our relationship as Halkahmi'kmaq people at the center of all the decision-making that happens at the Cowichan Watershed Board. And it is one of my incredible privilege and honors as a medical health officer to sit in red, circled there, denoting myself sitting as one of the members appointed at large within this watershed board. So there's been a lot of amazing work that has happened at the Watershed Board over the decade of its existence, and tremendous potential for when that decision-making, Indigenous worldviews and relationships are centered within the decision-making. But the Watershed Board operates at a local level, and it's affected by many things beyond that level, including provincial legislation. And while we have centered relationship at the Watershed Board level, how we give to the watershed so that it can also give back to us, we operate within a provincial construct, which is largely from a very one-sided viewpoint. A couple examples here are the Drinking Water Protection Act, of which I have authority as a medical health officer within. And within this legislation, it defines drinking water as used or intended to be used for domestic purposes, that is human consumption, food preparation or sanitation, or other household purposes. So really within this legislation, water is something to be used for our benefit, not a living being we have a relationship with. There's also been recent work even earlier on this year within the province to look at creation of a watershed security strategy and fund. And it's critically important that this work is done and that we have the money to invest and protect our water. But really still at this point, it's largely defined, watershed security is largely defined as the availability of good quality water for healthy ecosystems and communities. So while we're looking at ecosystems and communities there, it's still a very one-sided relationship of watershed, the watershed being something that's available to healthy ecosystems and communities. So in envisioning, really what that relationship looks like within the provincial legislation at this point, it's water being available to Indigenous communities, governments, or diverse sectors. But really what I think we need to do to, in fact, make big changes is really view this as us giving back to water as much as water gives to us, and really forming that basis of the healthy, resilient relationship that have been within the places we call home for generations upon generations. And what I see as a public health physician in the roles and the spaces that I get to be within is that the Declaration on the Rights of Indigenous Peoples Act is actually a tool to try and connect the cycle of what is currently the Drinking Water Protection Act, really looking at like a one-way relationship, and having the Drinking Water and the Declaration on Rights of Indigenous Peoples Act protecting those spiritual relationships and allowing us to give back to water after all it has given to us. I want to acknowledge a dear friend and colleague of mine who's working at the, she's a Deputy Provincial Health Officer in Indigenous Health, and her and I have taken a dive into what this might mean for us as public health physicians and how we look at legislation, reconciliation, and water, and how we can move upstream to implement the United Nations Declaration on Rights of Indigenous Peoples in BC to promote Indigenous peoples' health, and also ultimately to renew and heal relationships with the places around us and help with these devastating impacts we're seeing of biodiversity loss and climate change. Really, if we look at, what we can do to protect water sources at this point, it's extremely retroactive. We need our legislation leaves lots of gaps to being able to protect the sources we have for the water that we depend on. And so how can we really look to protect that so that it can continue to give to us? So I want to end there and just, make a shout out to many of the people that I work with in this area, and really want to really spread hope that I think with the Declaration on the Rights of Indigenous Peoples Act right now in BC, we have a real opportunity to heal relationships and take a very different approach that I think is ultimately very foundational and fundamental to looking at some of the crises we're in terms of our environment. So Heit Sapka.
Dr. Waters, thank you so much for taking the time to remind us of the importance of spiritual relationships with the places that Indigenous peoples call home, and for highlighting the cruciality of land as a determinant of health. Thank you so much. And also to all the attendees, my apologies for, I think, disappearing mid-sentence. There was a mighty boom outside and everything went black, but I'm back. Thank you to my colleague, Donna Atkinson, for filling in. Also, just a reminder to be putting your questions in the Q&A panel, and we'll make sure to get those at the end of the session after Dr. Chris Mushquash has completed his presentation. So without further ado, I will introduce our second speaker, Dr. Chris Mushquash. Dr. Mushquash is a Canada Research Chair in Indigenous Mental Health and Addiction, and professor in the Department of Psychology at Lakehead University and the Division of Human Sciences at the Northern Ontario School of Medicine. He is the director of the Center for Rural and Northern Health Research at Lakehead University, interim executive vice president research at the Thunder Bay Regional Health Sciences Center, and chief scientist at the Thunder Bay Regional Health Research Institute. He is also a registered clinical psychologist providing assessment, intervention, and consultation services for First Nations children, adolescents, and adults at the Dalico and Anishinaabe Family Care. Dr. Mushquash is Ojibwe and a member of the Pays Plat First Nation. Dr. Mushquash, thank you so much for joining us today.
Thank you so much for the opportunity to be here. Very, very pleased to be able to present today and join this group in a conversation and Q&A afterward. Thanks to Dr. Waters for the presentation. It's wonderful. I want to apologize in advance. I'm a little under the weather. So if I have to mute myself to cough loudly, it'll only be because I'm trying to save your ears if you're wearing earphones or headphones. I think I'd start a little bit with something that's very, very obvious, and that is that, although Indigenous peoples are often described as a large group of people across Canada, really we have very, very diverse histories, different cultural traditions, languages, methods of healing, and so on. This uniqueness is very, very important because, just as Dr. Waters was saying a moment ago, there's a tremendous amount of knowledge and a tremendous amount of wisdom and experience that's embedded within each of those cultural traditions. So, I don't think I'm saying anything here that is something that people on the call aren't aware of, but I do like to set the stage that way, because I do think it is very, very important that we do recognize that uniqueness and certainly honor those diverse, rich traditions. That said, within many of our communities, we have experienced this shared history of what we might call the colonial imposition, but as well ongoing processes of colonization that have disrupted health, but also mental wellness. It's not too difficult to see that when you have groups of cultures of cultures who are functioning reasonably well, and then you go through those historic things that we understand now to have happened, that can be profoundly disrupting to health and wellness at the individual, family, and community level, but also, as Dr. Waters was saying, at the environmental level. Also, in terms of similarity, not just the colonial imposition and other more recent contextual factors, but oftentimes there's a bit more of a similarity in terms of understandings of overall wellness, and that overall wellness somehow being represented or encapsulated by a function of the balance between mental, spiritual, physical, and emotional domains, and that, you know, in some way, if this balance is disrupted, that wellness is undermined, and that, you know, this is where you know, when people start to be unwell. Additionally, and again, I was really happy that Dr. Waters presented ahead of me, because you know, the idea that wellness is embedded or explicitly embedded in identity is something that's relatively consistent across Indigenous communities. You know, the interesting thing about that is in sort of Western biomedical, you know, approaches to health and wellness, it's more implicit, but it's kind of there. And what I mean by that is, if you look at, say, evidence-based psychological treatments, for example, CBT has schema, and DBT has a life worth living goal, and you know, you've got these sorts of ideas that are foundational to the modality, that also are representative of something, you know, larger than say you know, symptom management. It's sort of like, who is it that you think you are? And, you know, similarly, you know, when someone is ill and interfaces with the biomedical system, it's very often the case that if that thing which they're trying to recover from or get better from is aligned with who they are as a person, that they're far more likely to sort of follow the treatment as the treatment is meant to be, you know, administered. So, for example, you know that athlete who's injured, you know, she goes to a preoperative assessment, and perhaps even preoperative physiotherapy, and then you know, has a surgery, does everything that surgeon has to say, does all of the pre-surgery work, goes back to physiotherapy afterward, because you know, her goal is to get, you know, back on the track, or back in the pool, or you know, back running, or whatever it is, as fast as possible, because that's who she is. Similarly, you know, the person who's tried to stop smoking for many years, with success that sort of waxes and wanes, you know, then learns that they might become, that they're going to become a grandparent, and then it's, you know, decides that you know, they want to you know, make sure that they're not smoking around their new grandchildren, and then they stop smoking, and that's sort of the end of it. So again, you know, we do know that identity piece is implicit in a lot of sort of biomedical approaches, but it's explicit in a lot of Indigenous healing practices. So, you know, the foundation, the place by which wellness will come is actually you know, in connecting to who it is that we are. And I think those things are really important. They include associations with time and place, connections to land, and relational interactions with elders and other cultural knowledge keepers. Healers are considered a part of this mechanism of healing. And in this way, the health of an individual is embedded again within that history, culture, the family, the community, and the environment. A markedly different view from those non-Indigenous concept of mental wellness, which tend to focus on deficits and problems as being the major determinants. Now, the challenge with deficits and problems is that, you know, we devise services and direct types of treatment that tend to be applied to individuals. And in some case, there is a relevant evidence base, and there are relevant approaches, but oftentimes complexity and comorbidity is more of the rule, and appropriate services are unavailable. And you know, while these mental health services have been implemented to try and address a need in these ways, you know, we can argue that it's not necessarily meant, not necessarily met the cultural and contextual reality of what our communities and people need. And there has been a lack of overall engagement in terms of how those services ought to be developed and provided. we do know that the needs of Indigenous peoples are often greater in comparison to non-Indigenous Canadian populations. We don't have to spend a lot of time on the statistics related to, a range of mental health difficulties, although data tend to be generally lacking. What we do know is that overall, Indigenous young people are at a heightened risk for experiencing a range of mental health difficulties, as are adults, and that young people are also at risk of experiencing adverse childhood experiences at rates that are greater than the non-Indigenous population in Canada as well. We have a paper in press, for example, demonstrating that adverse childhood experiences for Indigenous peoples in Canada are increasing. Now, the challenge with that is that, and again, I'll slow down for a moment and make a quick distinction, and that is, individual level prediction from population level health is difficult. And really, when we talk about population level data, we shouldn't be applying it, to individual level prediction either. So that's an important distinction. But what I will say is that if we know that on average ACEs are increasing, well, a very small percentage of a very large number is a very large number. So it's something that we need to be paying attention to and being aware of as what might be coming if we aren't able to intervene in the meantime. The impact of this adversity is cumulative, of course, so that the addition of an adverse event increases risk of poor health outcomes in a dose response way. Now, many Indigenous groups have developed their own models for the implementation of care within our communities. So there are examples, and I've pointed to some examples in the report, the Mental Wellness Continuum Framework, which identifies overarching themes across cultures in Canada, and suggests or shows that these sort of domains are both factors that contribute to wellness, but also can be considered sort of outcomes of wellness as well. And that is when people have hope for their future and their family's future, when they have a sense of belonging, when they have a sense of meaning, and when they have purpose in their daily lives, right? So that excuse me, that hope, belonging, meaning, and purpose is very, very central to being well. And if we are experiencing disruptions in any one of those areas, the likelihood that we're overall doing well begins to become undermined. Now, I'd like to share the First Nations Mental Wellness Continuum Framework model with non-Indigenous people as well, because it's not just Indigenous peoples that need to be hopeful and need to belong and need to find meaning in their lives and need to have purpose in their day-to-day life. When it comes to anybody, I would say, it's important to consider those things. And, when we talk about our systems that we've devised, I mean, I don't know when the last time any of us had a conversation about those things with a healthcare provider. Oftentimes we're focused on very different things. The mental wellness continuum framework also includes, the Honoring Our Strengths framework also includes a whole range, a spectrum of culturally and contextually appropriate supports and services, all the way from health promotion, prevention, community development, and education through early identification, intervention, crisis response, coordination of care and care planning, detoxification, so more specialized service, trauma-informed treatment, supports and aftercares, et cetera. Now, these models of care have been discussed and in many ways implemented at various levels across our communities in Canada. It's sort of necessarily the case at present that many of these attempts at implementation have also been hampered by a lack of resources to sort of see them fully realized. So as well, corrective measures are required across a range of areas where Indigenous peoples find themselves interfacing with the non-Indigenous health system. And you don't have to go very, very far, even in the mainstream media, to find regular reports of incidents where Indigenous patients have experiences of exceptionally poor care and exceptionally poor outcomes. We can cite examples that are certainly just awful, and they happen very, very frequently. So the development of treatment that addresses these community-specific mental health needs that integrates and fosters a greater sense of wellness, it becomes important. So understanding again the connection across health, mental wellness, the environment, and so on is really, really important. I think that oftentimes we are still saddled by systems that sort of imagine or perhaps say that they understand these things, but actually, functionally don't really. So we have these different ministries and different domains that don't necessarily interface with each other, even though they recognize that they're, very, very related. Dr. Waters talked about water. We have many, many communities across Canada, First Nations in Northwest Ontario, for example, who don't have access to clean drinking water. In fact, one of our communities here in the north, Mushquash, I believe, just passed 10,000 days on boil water advisory, I think, over the weekend. So that's a tremendous amount of time to have to be lacking access to potable water in a community. So we can go ahead and we can devise all of the culturally appropriate treatments for health difficulties that we would like, foot care, diabetes care, etc. But if we're not considering the fundamental lack of drinking water as being intimately related to metabolic conditions, or if we're not thinking about food insecurity and lack of access to non-processed food, then we are really not necessarily connecting those pieces in a way that are going to be functionally as effective as we would like. Prevention becomes very, very important. From a mental health perspective, I think I've argued a number of times, and I've said this before, that it's a combination of lack of resources, lack of availability of health human resource, acuity of difficulty, accessibility of service, and so on. But if you were, magically able to provide every Indigenous person in Canada with a psychiatrist and a psychologist anytime they would like, I don't necessarily think that would be the thing that would, make us all immediately well. While those services are needed, there's a tremendous amount of other things that are needed as well. And those things include everything that we talked about a moment ago, from water to housing to access to education, economic development opportunities that are equitable, vis-a-vis the rest of Canada, as well as healing and specialized models of care that conceptualize wellness from our own perspectives and our own understandings. Delineating those concepts of culture and context more clearly, so that we understand the socially transmitted aspects of in a way of life, the cultural piece, but also the contextual factors, that is the situational variables that affect many of us, including that shared history of colonialism, those aggressive assimilation policies and practices, remoteness, poverty, a lack of access to proximal, intermediate, and distal determinants of health. So I think, visioning a future of an improved mental health system for Indigenous peoples in Canada is really going to require sort of a very, very broad approach from a very, very broad group, but certainly one that needs to be directed by Indigenous peoples wherever we are. And I think the other piece is ensuring that we're adequately funding and adequately resourcing our abilities to evaluate and conduct our own research to ensure that those things that we're doing are meeting the needs in a way, and that we have a good sense of what the needs are and how those needs may be changing across time. And in that way, it also requires a lot of important looks at governance and those important aspects data ownership and control and access and possession and so on. So, you know, I think in closing, you know, what I'll say is that if you look at a number of, you know, challenges that we're facing, and you look at the resilience and the strength and capacity within our communities and cultures, you know, what we have to, it's very, very important, I think, then to really try and do our very, very best to take those capacities and take those strengths and take, you know, those cultures and healing practices, devise and implement and appropriately resource, you know, the whole spectrum of services and supports required, rather than continue to sort of under-resource inadequate services that imagine wellness in a very, very narrow way, and that you know, are not necessarily set up in a way so as to lead to long-term wellness, because they don't necessarily recognize the interconnectivity of everything. So in any case, perhaps I'll leave it there and say thanks so much for the opportunity again. I look forward to the question period.
Thanks so much, Dr. Mushquash, for sharing your knowledge and information with us. I was particularly struck by your line, hope, meaning, and purpose are central to being well, and that's something that I think I'll carry with me as we go forward in this world of public health. We're now going to host a short Q&A, but before I jump into the first question, I wanted to just remind any participants that both Dr. Mushquash and Dr. Waters are contributors to this vision, this public health vision document, which we will be sharing as a resource. I'll show you how you can access that as we get to the end of today's session. But many of the resources that Dr. Waters and Dr. Mushquash mentioned are also in the references section of this document. So I would encourage you all to take some time to look at the document. It's available freely available via our website, and I'll show you how to access that after this session. Thanks again to both our speakers. Our first question is for Dr. Waters. It's a two-part question, but I'll just start with the first part and we'll go from there. One of our participants is asking if you could comment on extending the notion of reciprocal relationship with water to our relationships with forests, fish, the environment in general, and what does that mean for public health practice?
Sure, thanks for that. Yeah, I'll start off by a tiny story in that when Danielle and I were first talking about this type of work of using UNDRIP to fill the gaps that existed with what we saw in our public health work, that initially I had wanted to do an analysis of the Public Health Act from a DRIP Act perspective, but we had just had a water review done by the Auditor General here in BC, and when Danielle, who works in Bonnie's office, approached Dr. Bonnie Henry about this work, she asked maybe if we would consider looking off with water. And initially I was a little frustrated with that because I wanted to go big. It was about more than water. But then I realized water is ultimately connected to everything and that we did need a place to start. So yeah, I think water is where we've put some initial focus because there is a legislative review occurring, but it needs to be broader than that. And typically in conversations with the watershed board, often like community members will bring up the salmon and the trees. And the reason the watershed board came into being in the first place was because of the plight our salmon were in. I will say that Chief Lydia Huitsum is the chief here in Cowichan Tribes again. She was doing other work for a number of years. And we have just done what's called an official community plan review for the municipality of North Cowichan. So Huitlupnets, where I live, is within the municipality of North Cowichan. And people may have heard of official community plans, but it's basically like an approach to how land use in a Western perspective is approached within an area. And it's something all municipalities have to do underneath the Local Government Act. And really, we need to change, I think, that view of land use to land relationship as well. And it had actually been asked by Cowichan tribes that at the beginning of that official community plan, there be a recognition of Indigenous rights and titles at the beginning of that plan, which really I think is expanding beyond, like the Watershed Board had the recognition of, Cowichan tribes Indigenous and inherent rights and title to the area. And now we have to, like, what does it mean to start looking at that in, the day-to-day work in other areas, such as land use planning or other things, and how would that change what we call things such as land use planning? So yeah, I think looking beyond that, we also have a municipal forest